here for like 45 minutes.
Oh, oh.
Yeah, I can't hear you. That's all right, because as in, I think with Zoom webinar, attendees are automatically muted. But that's all right. If you have any questions, just there's a raise your hand function, I think, at the bottom, or you can just chat me on. That's good too. And there's also a Q&A function. You can also see that down there. So yeah, we'll just start in a bit. We have 4 minutes. Hey Ruth, thanks for joining. We're pretty excited about this one. We're just waiting for the other participants. Hi, Rosie. Thank you for joining us. If you have any questions that, come up during the presentation, just, just chat me on Zoom or use the Q&A function at the bottom. Or just raise your hand and I'll unmute you, whichever one you're comfortable with. I can see more people are joining us. Hello, thank you for coming. As I told the others earlier, if you have any questions that come up during the presentation, just, just chat me on Zoom or use the Q&A function. It's at the bottom of your screen. Or raise your hand and I'll unmute you. Beth really likes it when you have questions and scenarios because we really want to make sure that our presentation is directly related to your needs. So don't be afraid to ask us anything. We will start in a bit.
Good morning, everybody. How are you doing today? Let's see, I've got a couple of different videos and screens going on. So let me make sure that I can see you all. Thank you all for joining us today. This is a 2-hour opportunity to discuss what's going on with COVID. And looking at the group of people who are attending today, I can tell that this is a pretty experienced group. So I'm assuming that you're here, and I'm just assuming that because I have not gotten a lot of feedback yet in terms of questions or concerns. But my guess is you're here because you want to get an idea of what the real challenges are going to be potentially moving forward. And what I mean by that specifically is, and I'm sure a lot of you have been going to the presentations that the attorneys have been doing, which have just been wonderful, and SHRM, in terms of getting the background data. What are these details of what we're trying to deal with? It's a very different thing to look at the details of a regulation than to implement them. And I think one of the things that I really wanted to do today, I know one of the things I really wanted to do today is to, number one, encourage you and remind you, you're HR. This is what you do. This is what you're good at, is understanding the challenges of multiple regulations and then looking at your culture, your county environment, which has its own. In many of these counties, we've got our own sick leave regulations, especially for those over 500, which Department of Labor encouraged already. And in California, we made sure you're taking care of your employees in some areas. But this is not new. And 30 years ago, the FMLA and the ADA passed about 30 years ago. I think it's 30 years now. When we originally dealt with, and I think some of you, and just raise your hands if you can, how many of you were around when FMLA and ADA originally passed? And I'll do a poll. I'll let you do a poll. You can tell me, Lee, once we get the hands up, what percentage of the group has been around. Is it 50% or 20% or 5%? But when we did this, everybody, 30 years ago, we weren't doing anything different than what we're doing right now and what we want to do right now. And what I mean is, when we're in an environment of uncertainty, because there hasn't been any lawsuits yet to challenge the regulation and give us clear guidance, beyond the guidance that we get from the Department of Labor and the EEOC, who have both chimed in. And they've got some incredible resources, by the way, and I'll show you where to find those on our website, because we have been taking all of the state and federal documents that have been passed around the internet and put them in one place. All the questions and answers that the Department of Labor have put out, and the guidance from ADA and the EEOC. And they're very valuable, but unfortunately, we always end up in a position in HR when a new regulation passes of not quite knowing the details. And today what I want to talk about are the details in the way you implement this regulation, because there is litigation coming and it's going to be very, very substantial from what I can tell. Excuse me a minute. I'm going to just do something really quick. And why do I say that? I went to another workshop yesterday that was put on one of the very large firms in the United States. And the last 20 minutes of the workshop were listing all the ways that you could potentially get sued. And you know what? We already know all of those. They're no different than what we've already known about harassment, discrimination, retaliation, lack of consistency, creating environments where people are being discriminated or treated differently, because we're trying to figure out, how does this regulation fit in here, and how does it fit in there, and how does it fit in with this other regulation. And what I want to remind you is that with HR, there's two things that are more important probably than anything else. And I love this. This came from the president of SHRM, I believe. And he's saying, and they're even the title of, I think, their next workshop is "Stay in Your Lane." But you know what? The lane of HR right now is big. And HR does this. This is where we shine. This is what we do well. We understand what our company is. We understand our culture. We know our company policies. And irregardless of whether the regulation is clear or not, we know how to treat our employees consistently and with respect and continuity. And that's what I always want to remind you to do. There's nothing that you can't fix in terms of these regulations. So if you have made a mistake, or you didn't quite understand what you thought you should do based on guidance you got from an attorney or a workshop, or from me or somebody else, doesn't matter, or even from your own understanding of what you read. And then you later understand, maybe I didn't quite do that right. The real value of all of this, everybody, is that you can then fix it. And that's no different than what we've always done with ADA and FMLA at both a national and state level. And I think everybody's from California, so I can stick to California. And what I mean is if you had made a mistake and you inadvertently separated somebody or didn't pay somebody that should have been paid a benefit, or cut off a healthcare benefit when somebody had not fully exhausted their FMLA because somehow you retroactively designated it, even though the letter got sent out late, we go back and fix it. We just retroactively fix it, and we can offer them their job back. We can get them the money that they are owed. We can then provide them the benefit. And the one thing to remember about litigation is that we see a lot of litigation claims that say malice and intent. And if you've got an intent to act in good faith with your employees, and you do treat them with respect, and you are identifying a standard operating procedure for implementing this, and from what I can tell, nobody's really telling us. It looks like nobody's responding, so that's okay. But the key being that, let's see, I guess that's the question for you two to respond. So she put up the poll for you to respond. Where were you when FMLA and ADA were enacted? Were you doing these regulations 30 years ago? If you were, or even 25 or 20, you've got a pretty good understanding of the challenges associated with implementing a regulation that has this kind of complexity without clear understanding. And what we want to do is use those skills. Use the skills that you have as an HR professional to stay in your lane, understand the different regulations, integrate them when they need to be, and then make employees whole if there's a mistake. So we're going to go ahead and get started. And I want to tell you a little bit about who I am first before we get going, in case there's some of you who have not come to one of my trainings before. I'm both a human resource management and a vocational rehabilitation consultant. And what that means for some of you who are newer in the profession, maybe the last 20 years, in 1994, we gutted the workers' comp system. And as a result of that, we focused on making sure employees understood ADA, because if they had a workers' comp claim, the workers' comp carriers are now responsible for putting in that documentation that the employees are also potentially covered under ADA, and we are required to provide that, but the workers' comp company has nothing to do with that. Prior to that time, and prior to them modifying the workers' comp regulations, vocational rehabilitation consultants' primary job was making sure your injured worker got back to work. So they really understand what an essential function job description is. They know how to create them. They are now the individuals who are working in the Department of Rehab, because the whole occupation of vocational rehabilitation consultant helping injured workers return to work got decimated in the state of California, and they don't really apply anymore. Insurance companies will not hire vocational consultants anymore to help your injured worker get back to work under workers' comp. They still hire nurse case managers, but the voc rehab case managers disappeared. So the majority were not around. And those of you who were, please do not hesitate to raise your hand, speak up, give us feedback as I'm talking about the challenges. And not only that, I would say the successes that you had and what you learned in enacting a regulation that was not enacted before. And I don't know how to get rid of that poll. I think I'm going to let you do that, Lee, so now everybody sees it. We can get it out of the way. So in '92, when I was in my master's degree and the ADA was just passing and being enacted, I worked with one of the professors that did the seminal research on essential function job descriptions for firefighters. And if you can think about it, in general, firefighters were male occupation. They still are primarily male. And the reason that we started with firefighters, or that some of the original work got done with firefighters, is that women were being systemically discriminated against. Of course, a female cannot do a deadlift carry and handle a 100-pound hose. And so what we discovered through the development of an essential function job description is that we are creating a job description that identifies what method you use to perform the essential functions of the job. And then when you accommodate on the method with which the job is normally performed. And as a result of that, they either can then perform the actual job function that's essential with that accommodation, or they cannot. And if you don't know this, you are not a qualified individual with a disability unless you can perform all the essential functions of the job with the accommodation or without it. And so this is something that we understood very early on. And it was vocational consultants who understood how to create those essential function job descriptions. And they still are some of the best resources for creating those documents, by the way. So as a vocational consultant, and I still work for the federal government for ticket to work, Social Security, disability insurance, helping people get back to work. But as an HR consultant, we have a different perspective. From HR, we are really two-sided. We have the side that takes care of the organization, knows their policies, knows their procedures, knows the union contracts, knows the memo of understanding, understand that there's a bottom line that the organization needs to reach in order to be successful and stay in business. And we are every year getting closer and closer to the understanding of HR's need to be in the C-suite and have a desk, a seat at the table, because we do impact the bottom line. Historically, HR has been seen as a loss leader because we typically cost the money for the organization. HR has the benefits. We have the medical, we have the sick leave, we have the vacation. And what's happening now with these other regulations with Family First FMLA and Family First sick leave is we've now given employees another way to take leave. And when you're dealing with the complexities of FMLA and ADA already, and in California, that's over 5 employees you're dealing with ADA, and now you're dealing with Family First FMLA from 0 to 50. And then from 50 to 500, you're dealing with FMLA the way you've always had to deal with FMLA. But what you have is a new FMLA benefit. So this isn't new FMLA. This is just another way you can get access to FMLA if you have between 50 and 500 employees. So what I understood very quickly on when I graduated with my master's degree in '92 is the crossover between ADA and FMLA and workers' comp. And I can tell you that this has not changed with Family First FMLA. It's gotten more complex, but these underlying issues and the underlying standard operating procedures and the underlying methodology that we have used all along for FMLA and ADA are incredibly important. That if you're going to modify those underlying standard operating procedures, or if you've never really had good standard operating procedures to begin with, we're going to talk about what those can look like. And more importantly, we're going to talk about why you need them, because there is going to be litigation and there's going to be a lot of it. And one of the other things that I have also been doing for the last 30 years is provide expert testimony. So when your organization gets sued, your corporate attorney is usually not the litigator. They have a very different role in your company than managing litigation. And when you get to litigation, the litigating attorney often calls somebody like me to have an opinion regarding HR industry standards of care. And whether the HR person or the person most knowledgeable about the procedures and policies in the organization understood what those HR industry standards are and effectively implemented those standards. That will be the criteria, everybody, that we are utilizing if you, and potentially when you get sued under these regulations. So what I want to do today, and what I always do whenever I do training, is I'm not an attorney. I'm not trying to be an attorney. Your litigating attorney calls me when there's litigation to have an opinion about whether this was done correctly. I'm going to stay in my lane, and I suggest you do also. And what we're going to talk about today is, what does that mean as an HR professional when you have a new regulation that has not been tested in the courts and you've got to make decisions that you can't find a clear black and white answer to? And that's what we're going to talk about today. And we've got a lot of different ways to do that. We can, oh, thank you. A lot of different ways that we're going to talk about that today. I have I think 1 or 2 questions at the most, but I've got about 40, actually I've got about 120 that I've answered just in the last few days, in the last 7 days, that I'm going to also introduce if I think they're valuable to expand on the knowledge that I want to share with you today. So as an expert witness, what we do is we look at all the documents. So when I get called to be an expert, especially if it's a state case, I could end up with 3,000 pages of documents to read. And what I'm looking for in these documents, I get all the emails, all the policy manuals, all the personnel files, and the emails are all the emails that are going back and forth between you and the employee, and you and all the managers. So those matter, everybody. Man, do those matter. Please be careful about what you are deciding to put in an email. And if you are getting an email from a supervisor, make sure you are managing that very effectively. And if they are inappropriate and making inappropriate statements about their attitude or their subjective assessments of an employee, that could potentially rise to the level of supporting harassment, discrimination, or retaliation, these managers should be written up and taught to understand it is not okay to use email as a dumping ground for their feelings. It is a way to specifically, objectively, and appropriately communicate about an employee. But the key in what I'm trying to explain is that all of these documents are going to matter. And if we get a case, and I get about 5 calls a week on average, by the way, everybody, and that's before COVID. That's right now without COVID. That's going to increase in another 6 months is my guess, or another 9 months. I'm not sure when they're going to start coming in. And this regulation lasts till the end of the year. But when we get a call for that, we are asking for all of these documents. If these documents don't exist, in other words, you don't have the document that said, could you please explain to us why you need family first sick leave? Which one of the criteria do you need? And if it's for your own serious health condition, what are you providing us? This is what we want you to provide us. Although the Department of Labor has said it's not necessary, they've also said they're going to litigate these cases on a case-by-case basis. And what that really means is when you are going to be sued, the documentation is still what's going to matter. Because if there's not documentation, everybody, it comes down to depositions. And depositions, if any of you, and let's ask this question too, Lee, has anybody ever been in a deposition? Have you experienced going through a deposition? For those of you who have not, it's tough. And the opposing attorney can spend 7 hours in a deposition challenging what you're saying, questioning why you didn't have any documentation. Did you really send that letter when you have no record that you actually sent it except for a copy of the signed letter? These are real issues and the real challenges that you'll run into if in fact you do get sued for one of these areas. And thank you for that, Lee, for getting that poll up there. And when we have to rely as an expert witness, oh, and a lot of you have, so you know what I'm talking about. It is really challenging to be in a deposition. And when you're in a deposition and you don't have documentation to answer the questions the opposing attorney is asking you, you're doing it from your memory. And the kind of question would be, so Susan, please tell me, 3 years ago at 10 a.m., how long did that meeting last with that employee when you were doing an evaluation as to whether you were going to provide mutually agreed upon intermittent leave? And when you can't answer that and you're trying to figure it out from memory, please remember that's what the employee is doing also. So then we end up with 2 stories that very often and most likely conflict. It's a he said, she said, but it has to do with just simply the meeting. Did I say this in the meeting? Did I get you the notification? Did you fail to return it? Is that why I cut off your FMLA? Did you choose not to even inform me? And so I retroactively designated, so I ended up cutting off your healthcare too soon. There are all these little issues that are very significant to FMLA as a regulation, everybody. And the FMLA regulation, when you're over 50 to 500, the FMLA regulation has not changed. It still applies. We don't have a lot of guidance of family first FMLA, but the ones that we have that say you only have to be there for 30 days, modified it, but it didn't change the concept of what we need to do with FMLA. And when you get judged in court, you're going to be judged on these HR industry standards. Now, what is an HR industry standard? An HR industry standard is different than a best practice. As HR professionals, we all need to be complying with HR industry standards at all times. A best practice is, oh man, wouldn't that be great? We should really be doing all of that. That's a best practice in our industry, and we want to strive for best practices. But an HR industry standard is expected. We're expecting you to comply with these standards. And unfortunately, when you go to training like these, they don't talk about HR industry standards. They talk about the regulation and what it says. And what I want to do today is talk about your HR industry standards of care. So one of the first stories I have about this, and the reason I like to bring it up, let's see, where am I at? Come on, go forward. First of all, I'm not an attorney, and I will not be talking to you about the law. I can't practice law as an attorney. What I am talking to you about is the situation that I will be in if you get sued and your attorney, your litigating attorney calls me. They're asking me to have an opinion regarding the HR industry standards of care and whether you as an organization, and very often you as an HR professional will be named on that lawsuit, complied with those HR industry standards. And one of the first things that we look at when you're complying is your own company policies. Well, guess what? We don't have a lot of company policies for COVID. Oh, so, sorry, I'm going to take a minute and pour my coffee because I'm at home, so my assistant's not here. So we don't have a lot of policies, but guess what? We need to have them. We need to have an integrated methodology for managing COVID, the Family First COVID and Family First FMLA, the same way we did with all of our other regulations like FMLA and ADA. And I want to give you a quick example of why this stuck home with me so seriously when I started doing this work in 1993. I had an organization that was incredibly proactive, and they had an employee who was a long-term manufacturing employee who had basically never was missed work. They were their work ethic was so strong that we could rely on them at all times. And they had an injury at work. When they had that injury at work, they needed workers' comp. They took workers' comp, and we were sharp enough even that 30 years ago to know that workers' comp ran concurrent with FMLA at all times. If they're gone more than 3 days in the state of California, they're running concurrently, everybody. FMLA, CFRA, workers' comp, all run concurrently. And then FMLA was exhausted, and the employee needed more time off, they said, for their own serious health condition, which was a workers' comp injury. And in case you guys don't know, if you fail to engage in the interactive process in the state of California, when CFRA expires, and CFRA and FMLA run together, everybody, you are, for their own serious health condition, you are violating 2 state regulations. Both FEHA and CFRA have a mandatory requirement that you engage in the interactive process when FMLA CFRA has exhausted, all the time, every time, no matter what. And we'll talk a little bit more about that as we go through. So we knew that there was an issue with ADA, but this was workers' comp, so the employee was fully released to return to work. They came back to work, and within hours, they were just hysterically crying because they were in so much pain. So we contacted the workers' comp carrier, and we still do this as a strategy, as a standard operating procedure, everybody, and said, listen, the employee disagrees with your doctor. They're saying they cannot return to work 100%. They are not able to perform all the essential functions of their job. And they are not, the workers' comp didn't require any accommodations. And they agreed to do a second opinion and take care of the second opinion. And they still will now, everybody. Don't be afraid to use that strategy right now in 2020, when you got FMLA CFRA ending, and it's for the employee's own medical condition, and it's workers' comp. Try the workers' comp carrier first if the employee says they disagree with what the doctor indicated. And so we sent them to the second opinion. The second opinion medical provider confirmed the same thing that the first opinion medical provider did, that the employee was not required or was not able to not return to work. Sorry, I need to move this so I'm looking in 2 different places. And so the employee was then sent back to work. When the employee came back to work, the same thing happened. They were hysterical. They were hysterical, and they could not stay to do their job. So we understood under FMLA CFRA that had exhausted. This was not an issue of medical benefits. This was an issue of whether this employee could be at work or not. And since the workers' comp doctors indicated that there was no problem and she should absolutely be able to return to work with no issues, we sent them to a second opinion under ADA. Now listen to what I said a minute, everybody, especially those of you who have been doing this for 20 years. Is there a second opinion under ADA? No, there isn't. But you know what? I've been doing second opinions under ADA for almost 30 years. Why? Because if it's good enough for the Department of Labor, it's good enough for the EEOC. And what we're really doing is we are confirming and objectively verifying, because we listened to the employee, and the employee said they had an issue with coming to work. So when we sent them to a second opinion under the ADA, it came back the employee had cancer, and they died 6 months later. The workers' comp doctor had not found that. There was no way we were going to identify that probably any other way. But the moral of this story is we were complying with multiple regulations, utilizing a standard operating procedure that we consistently and repetitively implemented to manage these very difficult compliance requirements for leave and accommodation in the workplace. This is another one of those regulations, and I really want to encourage you and remind you, you know this. You understand these concepts. You've been doing this, some of you guys have been doing this for as long as I have. And so there's not a great big new balloon in town or sheriff in town. There's just a different clarification of how we're going to implement. But once we determine the methodology that we're going to use, the most important thing you can do is be consistent. So we start, and this is how we always train everybody. We train an integrated medical leave and accommodation management system. because I've been doing expert testimony in this area so long that I know what causes these lawsuits. And it's not the big mistakes. It's the way we treat employees. It's the inconsistency in the way that we implement the regulations. And most importantly, it's the lack of documentation to show that we did what we said we did. And very often we didn't do what we needed to do. And that will show when we start looking at the details. So always start with understanding your compliance requirements. What are the regulations? For you right now, everybody, it's unless you're under 5 employees, it's FMLA and FMLA-CFRA if you're over 50, and ADA and FEHA. And it could be pregnancy disability leave at the same time. It could be CFRA baby bonding that you're having to integrate with this also. It is also going to be workers' comp. And it's going to be whatever other policies and procedures you have, including your own sick leave policies, because we've got all sorts of nuanced regulations that say that if they are using the family first sick leave, you can't run your sick leave with it. You can't run California sick leave with it. You're not going to be running your state sick leaves or your city sick leaves, and that's unless that's actually the sick leave you're providing because you're over 500 employees. And we've got one person who is over 500. So they are looking at some of these issues that they have to deal with by state if they're in different cities that tell them, you will do the 2 weeks of COVID sick leave because we want you to. And we're going to make sure that you are generous for your employees. I am seeing most large organizations provide some kind of additional 2-week benefit when they're over 500. But I'm regressing. What I want to make sure that I'm getting across is that please make sure you've got a cheat sheet or something that you're using to understand which regulations run concurrently when the employee walks through your door. That's where all of this starts, whether it's family first sick leave or family first FMLA, because you're going to have other things that are going on. And I'm confident that you already are running into these issues. Once you've determined what the compliance requirement is, and for family first sick leave, they've got 6 different reasons that they can take this sick leave, but it has to be for one of those 6 reasons. And we've got the ability to have them confirm why they're taking this sick leave. Then we've got family first FMLA. Family first FMLA, they get after 30 days. That changed FMLA. They get it whether they have worked 1,250 hours or not. But what this is a new access to FMLA. So if they don't have FMLA already available, they don't get more FMLA leave. This is an additional 12 weeks. This is if you have FMLA available right now, you can use some of that for family first FMLA. But you don't get to use it unless you've got FMLA available for the people who are over 50. And let me just make sure you are all over 50. So I'm going to keep talking from that perspective. So you all have to deal with FMLA. That means that this goes till the end of December. And when they become eligible for FMLA again, then they could use all of that FMLA for family first FMLA. If it's for taking care of a child because school is closed or their normal child care is closed. So if they don't normally take care of a child in the summertime and that child doesn't normally go to daycare or child care of any kind when school is closed, they don't all of a sudden get access to this benefit when they've never needed to use or be at home for child care before. Now, how are you going to ask some of those questions? And I'm going to go over those ideas with you as we continue to go through the process because today in the training, because what I'm speaking about today is HR industry standards. How do you implement these regulations with all the other regulations you're already complying with? What are the nuances you're going to need to take care of? And one of them is supplemental wages. Once you get them the COVID-19 wages, if they're not whole, could they use their other vacation and sick? Well, sure they could, but you don't have to let them do that. What does your policy say? Is it may or must? And already we know under FMLA, you cannot require an employee to supplement an existing FMLA paid leave that is paid through SDI, PERS, paid family leave, long-term disability, short-term disability. The employee needs to request to use additional accrued benefits. And so we're suggesting, as a part of your standard operating procedure, let's make sure we're putting that in a certification document where the employee has to formally request that. So as we're going through some of these challenges, the whole concept, and I get such a kick out of this because pretty much every training I've gone to, the attorneys all assume you'll roll back. And I'm assuming they are, I believe they're assuming you'll roll back because 30 years ago, an attorney said, you know what? If you don't roll back, your employees can stack their leaves and take advantage of you. And I can tell you, after doing this for 30 years, your employees aren't doing that. That's not what's happening. And rollback is the most complex way to keep track of FMLA. Every other leave you have is roll forward. If you have a rollback environment with FMLA, every time they take an intermittent leave, you've got to roll back to see how much they've used so you know how much they have left. If they are going to be taking leave over the next 9 months or months that are left for the end of the year, you've got to roll back every time they want to take this leave for one of the various reasons to see if it's available or not. So just as a show of hands, Lee, let's ask how many people are roll back and how many people are roll forward. And I just want to give you this gift today. Think about it like this. FMLA is a designated period of time. If you roll forward and FMLA started today, you know that from today until May 6, 2021, they've got 12 weeks to use. 480 hours if they work 40 hours a week. If they work 50 hours a week, by the way, it's 50 times 12, everybody, not 40 times 12. And exempt employees typically work over 40 hours a week. So you need to make sure you know how many hours of eligible leave they have. And that includes eligibility. All of you are rollback. Oh, nope, not all of you. Some of you are. Oh, good. I'm glad to see that some of you are rolling forward. If you want to switch from roll back to roll forward, let me know, send me an email, chat Lee, and I will get you the document that I created that is a detailed process for how you switch from roll back to roll forward. The value of doing that, everybody, and I've been purporting this for 30 years, is that you can be in control and you can predict the leave that's left and available, which means you can tell your managers when to expect that employee to come back because you know when the leave has to end, because you can easily add up the days on an ongoing basis because they've only got 12 weeks in 12 months and it started today and it ends a year from now. So I'll stop talking about the roll back and roll forward now because it's such a point of contention for me. So I'm going to end the poll. I guess you do these or I do these, Lee. I'm going to end the poll and then I share the results. And then you can see, everybody, that you're about 50-50 roll back, roll forward. Once you've identified your compliance requirements and how people can get access to the leaves, including sick leave, family first, and sick leave and family first FMLA, create a cheat sheet. And Christopher Boucher did this. If you go to his website, I bet you can find it. Did a really nice matrix of this if you want something simple on COVID family first sick leave. That's just nice and simple and easy. But then you've got all your other regulations. You've got your regular FMLA, your regular CFRA, your baby bonding CFRA, your ADA FEHA, your pregnancy disability leave, your workers' comp, and then how people get paid. Sick STI, paid family leave, PERS, short-term disability, long-term disability, regular sick leave, California sick leave, new state sick leaves, new federal sick leaves with Family First. These are all compliance requirements, everybody. Take the time to create a matrix to understand what it is that you need to do. Then when they walk through your door, what you're identifying is what regulations are implemented at the same time that you need to integrate. And then we want to communicate those regulations to the employee so they understand when Family First childcare ends, it's done. They don't get any more. It's 12 weeks and they need to come back to work. And unless you've got some other methodology that protects them, and keep in mind, if you create something for Family First that protects people when the 12 weeks is over, you'll be creating it for everybody. It's not just a policy for Family First. It's a policy for anybody who exhausts FMLA, or you may have some challenges with retaliation and harassment and discrimination because you created a new category of benefit for people. So be very aware of when your benefits end and when they start and how they integrate and how you're going to communicate that to your employee. And please, everybody, if you don't know this yet, every single document you send to an employee that has to do with FMLA, ADA, pregnancy disability leave, minimally needs to be confirmed delivery, Federal Express, or certified mail. And UPS, it doesn't matter. Or 2-day air for the post office. Why are you doing that? Because if you send it by email, you don't know they got it unless they send you an email back saying, yes, I got it. But what if somebody else is using their email and they say, that's not me. And this is real. This is real stuff. I'm not making this up. All the information that I am giving you today is based on my experience as being an expert witness for the last 30 years, both for the Social Security Disability Administration and in state and federal litigation across the country regarding FMLA, CFRA, ADA, pregnancy disability leave, wrongful termination, harassment, discrimination for all the different protected categories. And you'll be amazed at what gets you there. And the challenge typically is in the way we are communicating with our employees and the documentation we're using. Here's another good example of how this becomes so significant. And when I go over the 5 key issues, you'll hear a lot of what I'm already saying, but because this is such an experienced group, I want to give you the big picture so you can understand the difference in an integrated medical leave and accommodation management approach and understand and training that helps you understand the regulations. It is not the same thing. We are HR. We have to create these standard operating procedures. As a group, as a profession, with these kinds of workshops and in the monthly meetings I do with the members that I work with, we create HR industry standards. That's who we are. This is where we shine. This is what we do really, really well, is understand the diversity of our culture, understand the challenges with the regulations, understand what we want to do as a company, and implement policies that meet the employees' needs as well as the organization's needs. Because the other part of that two-sided person we are when we're doing HR is being an advocate for those employee benefits. When we allowed that employee to go to get a second opinion under ADA, when workers' comp said she was 100% and needed to come back to work, because our standard procedure was to listen to the employee, and of course we documented that all in a good faith interactive meeting, we communicated, we were following up, we were making sure that we were listening to the employee, and our policies erred on the side of the employee, protected the employee, and we were allowed to be an advocate for them while we were still making sure we were checking our boxes, crossing our T's, and dotting our I's with the ADA. Then the other piece of this, and that's why communication, I just can't explain to you enough how important it is that you want all of those documents confirmed. You've got a piece of paper that that person received that document. I have case after case after case after case that I can talk about that is just because the employee says, I never got that. And the employer said, well, of course you did. Or the employee said, well, they never said that during the good faith interactive meeting. And you said, of course we did. It is the documentation that you communicate to the employee and get that signature on during the good faith interactive meeting that is going to protect you 3 years from now when they say, oh, that meeting was all about my performance. It had nothing to do with providing me an accommodation under ADA. They told me I either had to do this or I was going to lose my job. Those are the kinds of things you're protecting against, to make sure your record of information that you provided the employee about the compliance requirements that you are responsible for managing, they got. And then we follow up. And in the case of COVID, we do not just need to accept the employee's word. I can tell you that I worked a lot with very large HMOs. I have been working for the last 5 years with one of the providers, and the QC, the Southern California quality control evaluator to determine whether the medical certificates were done correctly or not. And I asked him about the challenge with getting to see a doctor, and he said there isn't one. You can get telemed and you can get in to see a doctor. Now CDC is saying, well, maybe you can't, they're overwhelmed. I can tell you that I've got a lot of healthcare companies as clients. They're now going home because they're not overwhelmed. Their beds are empty. So let's just not assume that we're going to not expect that employee to get us those documents. So if we ask an employee to provide us confirmation that they really do need this family first FMLA or this family first sick leave, and they're choosing not to, what's your standard operating procedure when people don't provide you the documents? If you don't have one that is date driven, boy, this is a really good time to have one and put it in place, because it's important for every single one of these regulations, even when COVID disappears, because we want to have a record that we provided in person and we acted in good faith and allowed them to give us those documents, and they still wouldn't give it to us. And that's why we denied that leave. That's the follow-up. The other follow-up is we provided an intermittent or reduced work schedule environment when they had their own COVID issue, and then they exhausted FMLA and it needed to go into ADA, and that was part of the accommodation, but they couldn't perform the job with the accommodation. This could all very easily happen. We've got, let's see, April, May, June. We've got till the next month for this to start happening. So at the end of June, your family first FMLAs are going to start switching into ADA. And those could be for the ones who stayed at home with their child that now created a different strategy for getting access to that. Or it could be that somebody had regular FMLA for a COVID qualifying condition or some family member they were taking care of. As soon as it is their own condition, they are going to be eligible for potentially for ADA and FEHA if they need additional leave for their own serious health condition. Now think about this and expand the concept a little bit. If I'm at risk because I have a disability that with exposure for this environment, in this culture, in this organization, in this way, and it would cause me to potentially be harmed, that could qualify as an ADA accommodation under both FEHA and ADA. So we would be then under the obligation under both ADA, or pardon me, under both FEHA and CFRA to engage in the interactive process when FMLA exhausted, because this would be a FMLA CFRA qualifying event, not a family first qualifying event. And I know you are all running into these convoluted and integrated issues because your employees are trying to figure out how to keep themselves safe, keep their family members safe. But performance matters. And this also matters when you are talking about an employee who is working from home. So if you have made a decision to allow your employees to work from home in a telecommute environment, and they are not performing at a meets expectations level, and your supervisors are allowing them to get away with that because you are an empathetic, wonderful culture that's just going to fill that gap. And then they ask for an ADA accommodation to telecommute, and you say, no, it's an undue hardship. How's that going to work? How's that going to work? How can it not be an undue hardship right now, but in 3 months or 4 months it is, or next year it is? Do you see the challenge? So performance matters, and it doesn't matter whether we are allowing telecommuting environments at home for COVID because we are essential or we can have them telecommute, or whether we provided an accommodation at work and the accommodation requires them at all times to perform all the job functions at a meets expectation level, or they're simply not a qualified individual with a disability. And that is across the board, whether it's COVID or not. So let's not create a standard operating procedure through this process that provides a problem for us at a later date because we created a new group of protected employees because we're so empathetic. Please really pay attention to what it is you are choosing to do and always ask yourself, but for COVID-19, Would I be doing this? And if the answer is no, and it's not something that's required under the compliance requirement, do you really want to change a standard operating procedure? I'm hoping that you are understanding the difference in the way that I'm presenting this in terms of HR industry standards and what you can create in your workplace that can be problematic next year when this is done. Let's hope it's done. And now your employees are expecting all of that opportunity that you allowed them to have when they were in COVID. And then, of course, this goes to the consistency with which you will implement this. If I'm asking for a COVID certification for Family First or FMLA or Family First sick leave, and I'll show you what we created for our clients to make sure that they qualify, and they don't provide it to me, I can deny. And what I do instead, and this is what I've been doing for almost 30 years, is for every environment, we give everybody 2 weeks to get us that certificate. They don't get us that certificate in 2 weeks, we give them 1 more week. They don't give us that certificate in 1 more week, we deny. We deny C for FMLA at all times, period, no loopholes. Okay, maybe an extra day or two, but not an extra week or two, an extra day or two. Because after that second request, if they don't provide us that certificate, we are transitioning for their own serious COVID condition to ADA, FEHA, and we have to. So we're denying FMLA, CFRA, transitioning to ADA, FEHA, giving them another 2 weeks, and if they still don't provide that certificate, we're gonna give them 1 more week, that's 2, 3, 4, 5, 6, and that next letter is denying ADA also. And then we are terminating based on our own company policies, procedures. We are never terminating because of ADA under any circumstances. We are denying a benefit. ADA is a benefit if they qualify. You don't terminate because they don't qualify for sick leave. You tell them they've used up their sick leave and you apply your attendance policy. COVID, Family First, ADA, FEHA, PDL, these are all the same issue. Get a standard operating procedure in terms of consistently applying it in a timely manner. Don't change it. Don't give one person 3 weeks, another person 2, another person a month. Somebody else got 3 months. Somebody else got 1.5 years. Let's not do that anymore. Let's get very, very consistent about our intentions and make sure we're implementing them. So that's a high level overview. And what we're talking about today are the 5 big areas that I see you have the biggest exposure. And the first one is Department of Labor was great. You don't need to get any documentation. You don't even have to send any documentation, but they do have to let you know in about a day once they're gone that they're going to be gone. And yes, you can request some documentation, but you really, so let's just get beyond all that, everybody, and do what you know is the right thing to do. And what are you currently doing for your other leaves of absence? This shouldn't be a brand new methodology. This should be implementing the one you already have. And let's update the forms you already are using to include the Family First information so you understand whether it's for their self or family member. Is it a FEMLA qualifying family member, or is it a sick leave Family First qualifying family member or friend or somebody I know who would expect me to take care of? They're all under that list. They aren't under FEMLA. And you don't even get sick leave. You don't get Family First sick leave for your own serious health condition or to take care of another person. That's FEMLA. That's just regular FEMLA, everybody. Then what about this intermittent leave? And we're going to talk about this in a little more detail, but do you know, first of all, you do not need to allow intermittent leave. If you decide to allow intermittent leave, it is because you and the employee mutually agree that it's okay. The other caveat to sick leave, Family First sick leave and Family First FEMLA is it is supposed to be taken in full day increments. It's not supposed to be taken intermittently. You can mutually agree, but man, you don't have to. And once you start Family First FEMLA or you start Family First sick leave, it keeps going till the need for the benefit ends. It was never designed to be an ongoing, as needed, intermittent leave. Please do not put yourself in a position that you are allowing that to occur. Just think about the challenge you have already with all your other intermittent leaves. Do you really want to do that? You don't have to, not under Family First FMLA and not under Family First Sick Leave, but you can, and we're going to talk about that a little bit more. Are you sending those designation notices on time? FMLA still has FMLA regulations, even though this is another benefit under Family First FMLA. If it doesn't speak to the regulation in Family First FMLA, you're going to be rolling up to FMLA, whether you have 50 or not, to look for guidance, everybody, to make sure that you are following those criteria. And retroactive designation under Family First FMLA is going to be problematic. If you are not responding and letting them know that they're protected, and then you retroactively designate and cut off their health care when it's over, don't be surprised to see that called retaliation. And then let's create those standard operating procedures and apply them consistently. And review the online resources. There are so many of them. And let me see if I can just do that really quick before we go on to the next one. I'm going to go to this slide first, and then I'm going to show you some of the online resources. Or maybe, Lee, you could bring that up really quickly. I don't know how that works, though, in terms of, I'll bring it up. I can get it. We've got enough time. We've got a two-hour piece. I'll bring it up. So will there be litigation? Oh, yeah. There's going to be a lot of litigation. And when you start hearing the attorneys tell you during their training programs, and they're still doing them free, it's just wonderful that what the support system for HR has done to give us the help that we need, including organizations like SHRM and HRIC and other training organizations. It's going to be a matter of when, not if. And all the concepts of the Department of Labor that says that you don't worry about it, just make sure you're taking care of them and you don't really have to do this, ends with, and by the way, when you get sued, we will be looking at them on a case-by-case basis. I can't think of anything scarier than them trying to say, for every employee, we're going to look at it completely different to see what the problem is. And what I know for sure from an HR standard and an HR industry standard of care position is that our consistency is what protects us on a case-by-case basis. So let's not incorrectly manage these things. Let's have a very clear absenteeism policy, have a very clear healthcare policy. What are we going to do if they don't pay their copay? No different than what we would do with FMLA. I can tell you that the basic HR industry standard of care is to just keep paying the copay and then do a promissory note and collect it if they don't come back to work, which you can do with FMLA already. But none of you do. You all pay it. And why do you pay it? Because the administrative time for cutting that health care off and reinstating it when they come back or give you the copay is much more significant than the cost of just allowing it to occur. What about diminished work quality and productivity? Are you going to tell your managers that it's okay to have people telecommute and work at home on COVID, and they don't really have to meet their expectations of their job? That's a pretty big standard operating procedure deviation. We would want every stay-at-home employee to have the higher level of evaluation if they've never been telecommuting before than ones who have already experienced it and have done it, and you verified that they can perform at home. We would be doing and recommending weekly verifications that the work that expecting to get done is getting done, that we are very explicitly looking at those timekeepers sheets. Are they checking in and checking out? Are they recording that they're taking lunch? Are they working the hours that they're normally supposed to work? Or are we allowing them to work whatever hours they want to work too? I know that this sounds like this would be a really nice, beneficial thing to do during a very difficult environment in a pandemic, but whatever you do now, everybody's going to say, well, you let me do it last year. Why can't I do it now? Do you want to be in a position next year that you have to justify why you did it this month, but now you can't do it anymore. Why you didn't require them to perform at a meets expectations level during COVID, but now that COVID's over, you're going to require them to do their job. Think about this, everybody. This is a standard operating procedure. It's performance management. Let's not reduce our performance management requirements. At a high level, and
It's 11 o'clock.
At a high level, I will show you the forms in a few minutes, but I want to just start by, again, differentiating what we're doing today. I am not spending time going over all these regulations again. My guess is now that we're 2 months into this, that you know what the basic details are. It's family first sick leave. You've got 6 reasons that you get family first sick leave. You are subject to self-quarantine or isolation, or it is mandated that you don't go anyplace. And we're talking about something that is in writing that requires you to do this. You are advised by a healthcare provider to self-quarantine because you show symptoms or something else. And we already know that basically that's a 2-week window that they're asking everybody to separate themselves. They're seeking assistance. Maybe they can't get it. They tried. We want documentation that they tried. In our certificate that we changed, we actually added the issue of, tell us who you tried to get an appointment with. Tell us who you tried to do a telemedicine appointment with, that you were unsuccessful doing that with. And Lee, do you remember the resource that we were using at one of the other webinars we did? It was LocDoc or something like that.
ZocDoc.
What was it called? Say that again.
ZocDoc.
ZocDoc. There's thousands of doctors across the state that have signed up for this. And you can go to ZocDoc, is it Z? Yeah, ZocDoc, and find healthcare providers. Make sure your employees know about that. Are you caring for an individual that is subject to 1 or 2? And remember, it's an individual that you would be considered to normally want to take care of. It is not an immediate family member. We have changed that criteria. And then childcare. Are you at home because the school closed, or your normal childcare closed? And when you're home, you're that primary caregiver at home. Or do they have experienced a similar condition? And we have no similar conditions that we know that are confirmed at this point. They are not eligible for any family first FMLA or any family first sick leave if they're already on unemployment, everybody. If you've already riffed them, you've already put them on furlough, they are not eligible for the days they're on furlough, or they have been laid off, or they have been terminated. They're not eligible for these regulations any more than somebody would be eligible for FMLA. But for the family first FMLA, would they be eligible? But for COVID-19, would they be eligible? If the answer is no, it's no. It's still no. So they're not eligible when they're on unemployment, or they're eligible for unemployment when they're not working for you. Are they eligible for family first FMLA? If you've got over 50 employees, and you all do, they are only eligible for family first FMLA if they have FMLA available already. And I know you are not all rollback, so you will have an understanding of when that family first FMLA will become available again, because you're roll forward. You know how much they've used in the current qualifying year. It's a number you can come up with like that. For those of you who are rollback, do you want to print out a report for your employees so they know month after month, week after week, when another day will come available because they took a couple days here and a week here and 2 weeks over here, and that's when they'll be eligible for family first FMLA again? And you're not eligible if you've exhausted FMLA until your new FMLA leave starts. And you're not eligible unless you're the only person taking care of the child. If your mother already took care of the child, always took care of the child, and your mother no longer is going to take care of the child because they are concerned about exposure through the child and they are over 65, that would be a reason why you might need to be at home now when you didn't before. So let's make sure the criteria that we use to verify is non-invasive and non-discriminatory in its procedure, but have one. Don't choose to not verify. If it's the employee's own serious health condition or disability, it's not family first FMLA, it's regular FMLA. And with Family First FMLA, you don't transition to ADA, but for their own serious health condition, you do transition to ADA from regular FMLA CFRA as soon as regular FMLA CFRA has exhausted. But none of this applies to Family First FMLA. It's enacted on April 1st. This is going to go through the end of December. We're going to be reinstating employees with over 25 employees, just the same or similar position. For those, well, you guys don't have under 25, so I'm going to move past the rest of this slide because I know you all have over 50. So we enacted, again, the benefits. We pay their wages based on which part of the Family First FMLA they have access to. And so we follow all those regulations, and we know that we get reimbursement for these things, but this has caps on it, and we've got salaries that are due. And if we have employees that work any part of the week, we still have Department of Labor requirements that we have to use. These are the wages that they are eligible under Family First Sick Leave and Family First FMLA. But that doesn't remove your responsibilities for any other benefits that you have. So please make sure that you are really clear what your other benefits are for your organization, so you are implementing your standard operating procedures in an effective way, and you are making sure your employees are getting access to all of the benefits and criteria they should have access to in your organization. And then one of the most important things, always act in good faith. And we talked about this a little bit before. What does that mean? That means that, but for COVID-19, how would you treat this employee? But for FMLA, how would you treat this employee? But for Family First Sick Leave, how would you treat this employee? Make sure you are understanding what varies when you are looking at the different regulations. You err on the side of the employee if you make a mistake at all times. That's the most important choice that you're going to be making. If you retroactively designated Family First FMLA because you didn't have your documentations ready to go, give those weeks to them free and start from the time that they move forward. In terms of the money, you'll have to figure out how you want to handle that. But make sure that if you are retroactively providing benefits, for example, if they're furloughed and you decide to give them 2 weeks of pay, that's not Family First Sick Leave. And it's not Family First FMLA. You still owe them when they have work available and they need leave from the work that is available. That's when these regulations apply. Always consider ways to help your employees. If your employees are concerned and worried about being in the workplace because they are in a category of 65 or over, or they've got an existing health condition that makes them concerned, or they're not, they're 20 or 25 and they're just scared. Are we going to ignore that because the regulation says they're supposed to come back to work, especially if we're an essential employer, and now we're opening up our doors? You're going to have a lot of very scared employees. We are not wanting to recommend that you are drawing a hard line here. Now, there is a huge difference by industry. When you're a manufacturer, you need people on that line. That is a very different environment than an administrative service environment where you are all inside in your own cubicles and you've got a receptionist. And one of the questions that came up the other day when I was doing this is, well, my receptionist doesn't want to come to work because she's afraid for people who walk in the door. So let's brainstorm. Let's come up with some ideas. Err on the side of the employee. Sit down and talk to them. Have an undue hardship meeting, a good faith interactive meeting. It doesn't matter whether it's ADA. This is still a very well-established strategy, these good faith interactive meetings and these objective undue hardship analysis research that we do that can easily apply. And the issue is, if an employee says, for example, I'm a receptionist and I am concerned, Why don't we put a piece of plexiglass in front of where they are and give them a mask and make sure people have a place to wash their hands or do disinfectant when they walk in the door, or they are given a mask when they walk in. So many different ways that you can come up to do this. And I had a client who was also came to one of our workshops, presentations, I think last week, and she works for an organization that takes care of the homeless. That's their job, is they seek out and provide and help. None of their employees asked not to come to work for the last month and a half. They all figured ways, they worked together, they brainstormed, and they found ways to overcome their concerns and to help each other stay safe. So trust your workforce to want to do the right thing, be consistent, err on the side of the employee, consider ways to help them, fix a mistake as soon as you identify, and document exactly what you did to try and assist them. But if you have an employee who's scared, they're not over 65, they don't have a pre-existing condition that would put them at risk, they need to come to work when you expect them to come to work. If they do have any of those categories, we would be engaging in the ADA and looking at whether they're protected under the American with Disabilities Act. So let's talk about, let's see, it's got 10 after. Let's talk about what it is that you're really trying to do with these 5 primary areas that I see are some of your biggest risks moving forward. So we've got the family first sick leave. We know that they get 80 hours. We do that on top of any other benefit they have. They do not run concurrently. They are not required to use it with any other sick leave. There is no waiting period. They get it immediately. It is prorated. It is taken in full day increments, and we can mutually agree not to do that. For Family First FMLA, they've got a 30-day waiting period, and we're going to be covering these employees. So we're starting by making sure, do you have a leave of absence request form? Do you have a sick leave form? Do you have a FMLA notice that you're currently using? Now, how do we take what we already have and modify it so we're using it with COVID-19 sick leave and Family First FMLA? So we have good, clear, objective records that we can show we attempted to comply and the employee chose not to act in good faith. What is the reason the employee needs this leave? How are they asking to be paid? How do we want them to report their time off? What are the supporting documents that we need? Can you please clearly, specifically identify what do you mean by intermittent leave when you're requesting it? And by the way, Family First FMLA is not another 12 weeks of leave. What about the leave of request form? Is it for childcare? If it's for childcare, the school is closing, are you going to require them to tell you what childcare is closed and what school closed? Are you going to require them to tell you they are the primary care provider? What happens when Family First FMLA is over and now they say they can work from home and telecommute and they still have a child there? They needed childcare for when the child was there for Family First FMLA. The child is still there. They're still the primary care provider, but now they think they can telecommute? How does that work? If they want intermittent as needed leave, are you going to allow them to take Family First FMLA intermittently? So throughout the day, let's say they have an 11-year-old or a 10-year-old who can pretty much take care of themselves, but they're going to be stopping to getting them snacks and lunches and things like that. Are you going to allow them to sign out and sign back in? How often are you going to allow them to do that? Will they really be able to perform the functions of their job if they are doing this in an intermittent basis? These are all really significant issues. The question is, how are you gathering that data? And what if they are a teenager and they're asking for Family First FMLA? Do I need to provide Family First FMLA for a teenager, someone who's 14 or 15? Well, if they're under 18, they qualify, but there may be a reason. And by the way, if they're over 18, they're going to also, if they cannot self-care, they're cognitively disabled or some other way they're disabled. But there's other reasons we're at home with our teenagers that may have nothing to do with a disability or a cognitive disability. It could be a behavior related issue, or we need to pay attention. Are we going to get at those issues? But for COVID-19, would you be asking about it otherwise? Probably. So create a document that provides you a methodology to gather the data you want to gather and understand what the criteria is for eligibility. And please make them tell you about all the criteria they're eligible for, all the regulations they might be eligible for. So if it's PDL and Family First FMLA, at the same time, is it for two different things? Do they want to take their sick leave and use it when the Family First FMLA has ended after the first 2 weeks? I want that on a certificate. I've learned a long time ago that the best way to get data from any employee who is requesting these kinds of protections is when they ask for the protection from the beginning. That means your first documentation you send them is the most likely to be filled out. Giving them something on the phone to say, I'll send something to you later, and then I need something after that because this happened, and there's a problem with performance, and the supervisor's complaining that they're taking too much leave, is more difficult. And your employees start getting defensive, and they start feeling like you are singling them out. So if you take the time at the beginning to create very clear, well-developed documents, you're going to be in better shape. So let me make sure, that was a little late, but remember, Family First is not a separate regulation. So let's start with the clear leave of absence request form. We suggest two different certificates, that we have a leave of absence request form that has all the reasons they could qualify for these leaves, Family First FMLA, Family First sick leave, as well as all the other regulations. Is it ADA also? Is it regular FMLA also? Is it C for baby bonding? Is it PDL? Do they want to use sick leave vacation PTO? I want all of that on my certificate. Once I send that certificate and they tell me what it is they're asking for, then I'm going to send a second notice, one for Family First FMLA that explains to them what the criteria I have for that, including that they will work normal hours, that they will have an environment that is safe, that meets our safety standards, that they will follow our health and safety policy, that if we have a telecommuting policy, and boy, if you don't have one, you're going to want to have one for this. And we'll talk a little bit about what that will include later, and that they are aware of that, and that they are self-certifying if they don't have a doctor or they can't get the documentations to certify they need that leave. The same thing for sick leave. It is a separate certificate that I'm having them sign that is designed for COVID and to get at the issues that we're going to be concerned about that might lead to litigation under COVID-19. Do you need to send the notice of eligibility? Well, FMLA said you don't really need to do much, but boy, if you didn't, and it's case by case, and there's no record, and the employee said they never asked for it, but you decided that's what they needed, just think of all these scenarios that happen with regular FMLA. There is no reason to believe you're not going to have the same kinds of challenges. So let's follow a standard operating procedure, everybody. One of the things that HR does better than any other profession in the organization is anticipate challenges and modify things to proactively deal with them. Trust your intuition. Trust your experience, your education, and the skills that you have built over these last 5, 10, 15, 20, 30 years, and implement all of those skills in this COVID-19 environment. And even if you don't have to, it doesn't mean you shouldn't. And that means 3 years from now, when you're sitting in that deposition because the employee said that you did not take care of them correctly under COVID-19, do you have the documentation to show you did your job? If you've got a system already that you're using, please use it for Family First FMLA, because it's going to matter when there are challenges. Oh, good, this is what I wanted to show you. So this is actually our FMLA, let's see, I gotta do this in a very significant way. I'm gonna screw everything up. didn't want to do that. Now, how do I get out of full screen? I think I go there. Huh. I'm gonna have problems here. I don't know how to get out of full screen for some reason. I've screwed that up. I usually know how to do that pretty easily, but I'm afraid, oh, here, there's escape. Now I got it. Okay, go on. I don't want to end the show because something's going to change if I do. So let me see if I can do this in a different way. Nope, I can't. So Lee, I'm going to need you to share your screen in a minute, bring it up and bring up the home page and show me the COVID forms. And so what I'm going to show you is if you go to LeaveManagementSolutions.com, there is a resource section, or there's a product section that has a resource, COVID-19 resource. And Lee's going to bring it up so I don't screw up my presentation. But that COVID-19 resource has the Department of Labor questions and answers. It has the ADA guidance. It has every document that I've found on the internet that is from a department resource. And you're going to share your screen now, Lee? And she's showing you the COVID-19. She's going to go to the resources. Go ahead and open them up. And she's showing you the resources. And then we go to federal, let's go to California. And then I want you to bring up the COVID-19 certification form. And you know what? I think I'm going to go back and I'm going to do this on my screen, even though I have to change the presentation, because I'm concerned that, let's see, what slide am I on? I'm on slide 16. Okay, so I'm going to end the show, and there we go. That worked out pretty well. It wasn't as bad as I thought it was going to be. So these are the resources right here. If you go to the Leave Management Solutions website, a regular website, and go down to COVID-19 resources, we are and we continue to provide those resources on here, and they are pretty comprehensive in terms of the documents that are available. Let's see, where are the COVID resources? Federal litigation, type of discrimination, California, selected career. Am I missing something here, Lee? Because I'm not seeing those resources. Here we go. Nope, they're right there. So did I miss something, Lee? I thought we had these up here. Did something happen to this webpage? We're going to get them up there. I'm sorry, very sorry, but we were up there. Lee, why don't you fix that and let me know as soon as you've got a link for me to show everybody where those resources are, because evidently they're not showing up right now.
All right, hold on.
So then when we go to COVID-19, what I'm suggesting to you and talking to you right now is the leave of absence request form. This is what I'm suggesting you do. And of course, we've got this, our clients already have access to all of this stuff. We basically took our existing leave of absence request form and we added additional information to it so it could be easily used with Family First COVID. And just as a side note, the way we do this, let me get rid of all of this extra stuff. Oh, I've got these all open already. When we do this, what we have is a narrative that teaches you how to understand HR industry standards of care and fill out the form. And then we actually have the document itself. And in this case, when we're looking at the Family First certification form, what I'm suggesting that you do is you start by telling them, this is what it is. It's 2 weeks of leave. And it's based on a very specific criteria. And by the way, you do not get to have intermittent leave. Unpredictable intermittent leave is not available with Family First sick leave. Now, you could make it available, everybody, but you don't have to. And I'm highly suggesting that you don't. And I made sure that any of my clients who are working with us are telling their employees, this will not be happening. We might provide you a modified work schedule. And I mean modified work schedule, not intermittent leave. I don't like the term that FMLA is using, intermittent leave, because that's not what I would ever be agreeing to. I might agree to a start date and an end date where you take from 3 o'clock to 5 o'clock off every day to take care of your child. And I'm applying Family First FMLA for those 2 hours a day until it exhausts till the end of the year. Or I'm applying it, the sick leave for the first 2 weeks. But you can see that we're starting by saying, please tell us why you need leave. And then, by the way, these are the things that are going to be impacting you. This is what a reduced work schedule might be if we decide to give it to you. And we need you to tell us exactly what you are looking for. There will be no ongoing as needed, intermittent leave, unpredictable leave where you're walking out the door or you're just stopping to work. Of course, you could provide that, everybody, but I am not suggesting that you put yourself in that position because you don't have to. And then the other thing I want to know is, what other reasons could they be gone? I want them to tell me all the other reasons they need that leave so I know how to apply these leaves concurrently if they do apply with workers' comp and FMLA for myself versus my family member. And yes, I do want to take my paid leave, and I do want to take it and have it supplement my family first leave if for sick leave. We need this in writing, folks. So get it on your certificate. And then, oh, by the way, if this is for a medical issue, you got a whole different issue you're going to have to follow and a whole different document. And these are the things that I'm expecting you to understand about this kind of regulation. And you're signing that you understood what I asked you to understand. And then I always have a human resource piece to every leave of absence request form. I also have a supervisor piece, but I did not include it on the family first one because I didn't think it was as necessary because HR is managing these COVID issues. That's part of what we're suggesting that you do with the family first leave of absence request form. Then once you know the reason for the leave, get your documents in order, take your existing sick leave certificate, take your existing FMLA certificate, and modify it, everybody. This is the conditional designation letter that says, for Family First FMLA, you've got 2 weeks to get me a certificate, a Family First certificate that tells me why you need leave, what it's going to look like if you're asking for intermittent leave, so I can then engage in an undue hardship analysis. And yes, I am crossing terms from ADA to FMLA, because it works and it's a great idea. And it's an HR opportunity to document objectively why we are not providing intermittent leave, because they are not giving us good solid dates and times. These are all HR operational strategies, everybody. They haven't changed for COVID-19. And the more effective you are in maintaining the integrity of those operational strategies, the less likely you are going to find yourself in a lawsuit, because it's the consistency with which you implement, the objective data that you use to decide, and the documentation that you have to verify that protects you. That protects you. And you already know how to do this. So do what you already know, use the resources you already have, and update them. So if they don't provide us a certificate after the 2 weeks, then we're sending a second request letter. They don't provide it after the second request. We are denying. We are denying. And this is Family First FMLA we're talking about, that we've changed these forms that we already use to utilize effectively with that. But if they provide us a certificate, then we are going to designate. We will also do that. Are you doing a return to work release? We're not going to just signal everybody out who's COVID-19, and everybody who's COVID-19 needs to provide a return to work release when nobody else under any other medical issue has to. Well, yeah, because the CDC said we could. Okay, then make sure you follow the CDC guidelines to the letter if you're going to do that, because you are signaling out COVID-19 who took time off for their own serious health condition or exposure, and you're asking them for a certificate that says they are no longer exposed and the time has passed, or they don't have the symptoms any longer. Well, wait, why don't we just do that anyway, everybody? Why don't we take that return to work certificate or create a new version of it and have everybody who, before they come to work or walk in that door every morning, they are filing a certificate with it that they self-certify, I have no symptoms and I have not been exposed. And then on the floor, if anybody observes, we implement our safety and health procedure, and we remove them and have them verify if in fact they were identified to have COVID symptoms on the line or in the workplace. So you see, we're not creating a brand new strategy. We're using existing injury, illness, and prevention programs to identify how to respond when there is a risk of imminent harm to self or others if they come to work that might protect them for their own serious health condition under ADA, by the way, or under regular FMLA. So expand your perception and don't recreate the wheel. Take what you have and modify it. So let me show you what the Family First certificate looks like when we give it to them. And thanks, Lee, for doing that. It just felt easier for me to do it this way so I could control it a little bit better and speed up the process. And of course, this is the same kind of thing. We've got a narrative, and then we've got the document itself. And in this case, all of our documents have always been designed this way. They're designed so you've got a company-specific version that is generic, ready to go, out the door, and then when you need it, you fill in the yellow for the employee. Now, this is Family First COVID. This is Family First COVID, and we want them to tell us why they might be eligible for Family First COVID. And if they start talking about their own serious health condition, that's not Family First COVID, that's Family First sick leave. And I guess that's the one I brought up, was a sick leave certificate. Nope, here's a Family First school care certificate. So we identify very clearly at the beginning to make sure that we understand the difference, and so do they. And that any of those above criteria are not going to be eligible. These are all for a different FMLA. This is what Family First FMLA is for. We want them to know. We want them to confirm why they're doing it. We want them to confirm what the reason for it was and what kind of leave they're looking for. We want them to be very, very specific, and we want to make sure they understand our very specific guidelines, that they know they're acknowledging that they are not trying to misrepresent what they're doing. It is not complex, but it's very explicit to make sure that they are signing. And I would normally have put under penalty of perjury, but I know none of you guys are going to do that because it's too aggressive. So if they want to just say they acknowledge that they are that this is true and correct, I will accept that, because I've decided that's my standard operating procedure. I don't need them to print something from the newspaper that says the school is closed, for example. Then we've got the Family First actual sick leave certificate, if that's what they're asking for. It's the same concept, everybody. We have amended this to make sure it addresses what we can ask under ADA and not violate confidentiality rights by asking them to engage in a medical evaluation that would be otherwise confidential. And we put them through the same process. These are the reasons you could get the leave. If you're asking it for one of these reasons, you need to tell us why you need this. What did you do to try and resolve this? Please tell us what healthcare provider you said you talked to. If your healthcare provider will not sign this, we're gonna have you self-confirm that you tempted and you couldn't see it. And you know what, if you're getting a lot of these, you might wanna start calling healthcare providers to see if they actually have availability and your employee misrepresented that. They do that with this just as much as they do this with other FMLA, everybody. And then let's make sure we know when it's going to start and when it's going to stop. So you can see that it's not a big leap to attempt to provide these kinds of documents. Let's see, did I do this right? In the wrong spot. What it is an intent to make sure that you've got a standard operating procedure that you can look to, that has real documentation that you can utilize in the event that an employee is challenging what you have done it right or whether you have done it wrong. So ongoing as needed intermittent leave, boy, everybody, I am not going to get off of this one because this is the biggest issue to me. It is not required. I would never, under any circumstance, even allow ongoing as needed intermittent leave. I'm just not going to do it under Family First FMLA. But what I might do is a reduced work schedule leave, and we talked about that a little bit. If they are going to do ongoing as needed intermittent leave, I am watching it lock and hawk. I am making sure that those sign in and sign off on their time card are very well documented. if this is for someone who's exempt, you'll be paying them for that whole time, no matter what they did, if they worked any part of that day. So have you thought about that? Do you really want to be doing that? So let's make sure we have an effective, objective way to manage the data and how the employees' operations are impacted if we're not going to provide this. So even though the Department of Labor has said, you don't have to do this, they've also said, we really, 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 really think you should. And remember, they also said they're going to litigate on a case-by-case basis. So what this means, everybody, is you are treating Family First COVID and sick leave like ADA. Why? Because I need an objective document that tells me why I am not providing that requested intermittent leave. How are you going to do that? And what I'm suggesting that you do, let me see if I can get this done. I'm not going to end the show again because I figured out that that works. What I'm going to do is go back to my documents, because I do ADA. You guys all have many, many employees, so you clearly are doing ADA. But do you have an undue hardship analysis process? An undue hardship analysis process is an objective methodology for documenting why your organization is impacted by the request. Now, even though we're still talking about Family First requested intermittent leave that they're requesting we mutually agree to, I'm going to use that methodology. And Lee, I've talked about this before. We want to add this to our bank of documents because I'm going to customize this QID for Family First FMLA. And basically, it's not going to look much different. I can show you what our ADA form looks like, and I'll be taking this and modifying it to a Family First form. And again, I do this all the time, you guys, when the regulations change. You can do this also. And by the way, what you're looking at is our membership site if you're interested in any of these documents. It's pretty reasonably priced. It starts with trainings and flowcharts and checklists, and then gets to the actual document. And so what is the undue hardship analysis process, with or without workers' comp? It is an objective methodology for documenting how the organization is impacted that justifies the reason for denying the request for accommodation, or in this case, ongoing as needed intermittent leave, or in this case, reduced work schedule leave under Family First FMLA or Family First COVID. Because they have already said, everybody, that Family First COVID and Family First FMLA is meant to be taken in full day increments. And once it starts, it does not stop till the reason for the leave has exhausted. Remember that, because that's what the regulation is for. If you modify that with a modified work or intermittent leave, you're making that choice. So make sure you want to. And I have no problem changing this ADA to COVID-19 and leave. That's what we're going to be doing. And then I'll run through this and see what still makes sense. It's not going to be medical restrictions. It's going to be that they basically requested this. I'm going to figure out what the essential functions of their job are. And I want to see how, not necessarily the accommodation, but how that request for mitigated leave or mitigated reduced work schedule or intermittent leave impacts our company. And when we do this, we evaluate these under the same criteria that I would under ADA, everybody. Does it impact our business in a negative way? Tell me how. What are the operations that are impacted? Are they the most important person who does this and we can't find someone to replace them? Those are all valid reasons, everybody. And because this is designed for ADA, it has issues that are there to help you with job accommodation network. But the strategy is sound, is that you are coming up with an identified objective measure to confirm why you are denying that ongoing as needed intermittent leave that they are requesting under Family First FMLA that you are not required to provide. And when you say, well, I decided that I couldn't mutually agree, and the attorney says, well, you couldn't mutually agree because they're in a protected category of age, race, religion, etc., disability, how are you going to defend that? And if you've done an undue hardship analysis, You've got a very, very full, very, very detailed methodology that you followed that is objective, that justifies why you're not doing that. So let me make sure I'm actually on the right slide before I go, and I am. Let's see, that's 4, 4, 4. Nope, let's go back. There we go, we were there. So what you're looking at here is our actual membership site. You can get access to it by going to the LMS site and clicking on membership, and it will get there and show you there. But you can't get any further unless you're actually a member. Let's not forget that we need to make sure that we are providing in their confidential medical file all of these records if it is related to their own serious health condition, and you are asking for any documentation that has to do with their own personal exposure. And taking temperatures are always done in a very confidential way. They're going to stand 6 feet apart. They're going to be paid from the minute they get into that line, and we're going to be putting them in a confidential room to do that kind of work. We are not sharing names any more than we would under ADA. Think that level of protection for COVID-19 sick leave. Think that level of ADA. And keep in mind, ADA has already chimed in on this. So when I cross over and use ADA undue hardship analysis strategies for HR industry standard of care implementation procedure under COVID-19 for intermittent leave, that's not a leap. And I know it sounds like a little convoluted when I'm saying it, but think about it carefully and slowly. It's not a leap. It's a mechanism for you to protect your organization and do an objective analysis as to whether you really can provide that level of benefit that you are not required to do under either regulation. So documentation is key. Boy, I can't say that enough. There's no defined response time. Stick to your standard operating procedure. FMLA sick leaves and FMLA are taken together. The first 2 weeks of Family First FMLA would be Family First sick leave. Once it starts, it doesn't stop till the qualifying event ends, unless you choose to agree to mutually beneficial reduced work schedule leave. They can use Family First sick leave and Family First FMLA for multiple reasons, up to the full benefit of 12 weeks for Family First FMLA and 2 weeks for Family First sick leave. That is prorated based on their average hours worked in the last 6 months or what they were scheduled to work. Notification can be verbal, but boy, you guys know from now that I'm never going to recommend that. Not only does it need to be in writing, it needs to be in writing, confirmed, certified, or UPS delivery, because we need it. It's that important if you're going to end up in litigation. And you guys, some of you just are. So please listen to this carefully in terms of what documentation do you want to have available when that occurs. You must mutually agree to that intermittent leave. They're going to be looking at these lawsuits on a case-by-case basis. And when there's litigation, what we're looking at, and I get all the records, everybody. When I'm asked to have an opinion of HR industry standards of care for litigation, I get all the emails, all the policies, all of the procedures, all of the documents, all of the records, all the handwritten notes. We get everything. And so be careful about what you're doing in emails, and make sure that if you are ready to deny something that somebody is requesting and they really feel that they're eligible for it, that your documentation speaks for itself. If you need to explain anything in that documentation, it's not comprehensive enough. But when you're documenting, it's objective and fact specific, short, detailed statements, not your opinion about any of it. Objective, confirmable data, even for an undue hardship analysis for denying mutually requested intermittent leave. Create that standard operating procedure and make sure that you consistently implement it. You do not give one person 3 weeks and another person 2. You don't let one person not provide you a certificate and somebody else has to. These are issues that are really easy to be, they're really easy to be crossed over by department managers or HR specific practitioners. So if you are the centrally located HR department that passes this information down to other HR individuals in your organization, and some of you are big enough that I know you got that going on. First of all, we always recommend that leave and accommodation management is centralized, because it is too easy to then treat people differently in different departments. And that matters when you're litigated, that you have different people getting treated differently. It's a big deal. So we want you to be in charge and you to be in control, and make sure that your supervisors are not allowed to have these discussions with your employees. These could be medical discussions. They have never been authorized to do that in the state of California. They're not authorized now. They need to come up to an HR level. And if it is an HR level and it's not you and you are training down, get those documents to the HR people that are responsible for the different departments in different parts of the state or wherever they are located, to make sure everybody is doing it the same way. Even though it's not required, this is what's going to really help you. Take a breath, relax, decide on the procedure you want to use, and then consistently implement it. You can take the temperature, yes, but we even know that temperature may not even be valid. You can send people home, yes. You can conduct undue hardship analysis, of course you can. It's an objective way to decide whether you should implement the procedure. You can send designation notices and denial notices, and we should be. We should avoid wage and hour claims by making sure they are keeping track of their time for lunch and breaks when they're working from home. But not only that, do we have a really good policy that lets them know that of course they have to meet the expectations of their job? And does the supervisor know that they want to have that employee report to them and keep track of their time and verify the business expenses? Do we have a picture of their home environment? So this is where my workplace is. And if I'm in the kitchen and I cut my finger off, it's not workers' comp. It's workers' comp in this workplace I have here at home, and I can get a picture of that. Are we providing them resources, or are we paying for the resources, giving them a kudo and money for using their home computer for business reasons? Are you going to let them do that? What are the confidentiality issues? Are there other grants or other things that we might be violating by allowing that to occur? What are the management requirements of allowing them to do that? This is not to be taken lightly, everybody. These are very, very serious issues that can be easily overlooked and then cause a lawsuit later, not only because they were allowed to not perform at home and now we're writing them up when they're back, or they've decided they're allowed to not perform at home at a meets expectations level, and then they want to have that same telecommute environment next month or next year under ADA, and you're saying it's an undue hardship or not, or you're providing a higher requirement of meeting their expectation at work than you did during COVID. Let's use our injury, illness, and prevention program, everybody. It's got a code of safe practices in it. Let's add that CDC to those code of safe practices and make sure that we are complying with those in the workplace. Having somebody being required to come back to work when the stay-at-home order is over and not complying with CDC safety requirements is going to be problematic. And if they complain, that's a legitimate, valid complaint. And in the state of California, we respond to every complaint in a very timely manner. We need to have a policy and procedure during onboarding that explains to the employee how we do and respond to complaints for EEOC complaints. And we're documenting all of that. So let's make sure we are still confirming and complying with the standard operating procedures. And then thank you, Sherm, for this great statement. Stay in your lane. We are not reaching out to different criteria and different strategies when things are happening with COVID. We understand the basic concept. Now let's create a procedure that allows us to implement that in a consistent, effective way that allows our employees to trust that we know what we're doing. We are giving them access to what they get access to. We are empathetic when they've got something outside of the box. We will look at our normal standard operating procedures and policies to see if there's a box that they can fit in. And if they can't, we're treating all the employees the same and not creating new pockets of benefits for employees because we don't quite understand what COVID will or will not do. Once you've made a decision to and I don't want to say compensate, but over provide what the benefit requires, over provide for everybody and make sure that you're treating everybody the same. And if we start seeing some of these lawsuits come through and you have a standard operating procedure where you're like, oh my God, I didn't realize I wasn't supposed to do that. Act in good faith, retroactively correct the mistake. Because if there's litigation and you attempted to correct the mistake, you attempted to rehire the employee, you attempted to give them the money that you thought that they thought you owed them, but you didn't think you did, and they refused to cooperate, that matters when you're in litigation. Communication is absolutely the key to this process. Let the employees know FMLA is about to end before it ends. I do that 2 weeks before FMLA ends. I'm sending a transition letter from FMLA to ADA every time, all the time. So I'm meeting them the week that FMLA ends, and that's for their own serious health condition, everybody. Don't forget that. And COVID could be in that responsibility. A lot of people are getting sick for a very long period of time, or they could have used some of the Family First FMLA for their own child and then only had a couple of weeks left for their own condition and had to transfer from FMLA to ADA because they had exhausted 12 weeks for other issues that weren't related to them and they didn't have enough left over. You're really going to want to let the employees know that. When will these paid leave end? But they can take more unpaid leave. You're allowing them to do that. Oh, but by the way, that's going to end your healthcare benefits and your paid leave benefits. Let's make sure they know that. Failure to communicate is what causes litigation more than anything else, in my experience. The way the employee feels about how you treated them has a tremendous impact, just tremendous. So if you're using third-party administrators for FMLA, please make sure that you remember they are the water boy. They may be a really, really sophisticated water boy, but they're still a vendor, and you're responsible for every single thing they do. And by the way, if you haven't looked at your contract with that third-party administrator, take a look. They probably indemnify themselves, meaning when you get sued, they're not at the table. You are. So this is a big deal. For FMLA, ADA, you and HR are responsible for everything that everybody does when there's litigation. And the fact that they told you to do that will not protect you. Under 50, well, you're under 50, so I'm not going to go into that. But we are doing monthly meetings, everybody. You're welcome to come to them. We do them once a month where you'll be on our mailing list, and they're free. We'll be doing that through the end of December. We do have these emergency response packages available for you. They're pretty inexpensive. And if you're a member, you get access to all of the information that I showed you on the screen. For COVID, you get access to the COVID information. If you want to become a member for everything, you get access to ADA, FMLA, CFRA, FEHA, Workers' Comp, PDL. We create integrated medical leave documents. We don't have a letter for FMLA and a letter for ADA. We have a letter for FMLA, ADA, PDL, STI, FEHA, and ADA for pregnancy, for example, and baby bonding. So the employee really understands the challenges when they're getting integrated. Let's see, I think I'm going to keep going. So this is what our website looks like if you're interested in it. As an overview, let's start with understanding the regulations and making sure we understand what we have to do and what we don't have to do to comply with those regulations. That we are then integrating the regulations that occur at the same time. Family First FMLA, regular FMLA, Workers' Comp, and ADA could all occur at the same time, everybody. FMLA and PDL could be occurring at the same time as Family First FMLA. So please make sure that you are really making the employee identify what they are doing so you understand if it makes sense that these are integrated or that they are trying to cross over regulations that they should not be crossing over. And then we communicate very explicitly, let's have standard operating procedures, let's have clear certification documents, let's have clear leave of absence requests, let's have clear return to work certificates. And I didn't show our return to work certificate, but we just took our return to work certificate, pardon me. We already have a certificate that says, can you return to work with no accommodation? Do you need an account? You can return to work, but you have these restrictions and need an accommodation. And number 3, can you return to work because you are no longer exhibiting symptoms and you are no longer COVID, you are no longer with COVID. We simply added it to the return to work release. These are simple things to do. I think it took me about 4 or 5 days intermittently to modify the forms that we had to make sure they could work with COVID. And I think you could do the same thing pretty quickly, or just take a look at ours. And then follow up. If they are working from home, they need to be performing their jobs. We're HR folks. We need to protect our organizations. These employees need to do their job, and they need to do it as efficiently as if they were working at the office, or they're not eligible for working from home now any more than they would be eligible for working from home before COVID occurred. And remember that if you're allowing this to occur now, expect a request to occur later on from another employee in another department who knew that you did this and saw no reason why they couldn't get access to telecommuting also. These are all pretty significant challenges that are not obvious when you look at the regulation that will absolutely impact you when you're getting ready to implement it and your employees feel like you're doing something wrong. Then again, consistency. Once you decide on what that procedure is going to be, consistently implement that procedure and make sure that we are really being effective. And it looks like I think we've got a lot of chats. So my guess is there's going to be some questions here. And I'll get to those. Oh, I guess there's not as many as that. I'm going to get to those when I get through with the slides, and I'll go through them quickly, and I'll stay if I need to, everybody. So please know that I'll do that. And we had 2 questions, and I'll make sure I get those 2 questions answered. I shared some of my forms and employee announcements regarding Family First Act with the group today. I think they're asking, will I share? And of course I have. If an employee qualifies for Family First CFRA time off, which runs concurrently with FMLA, are they still eligible for CFRA baby bonding? CFRA baby bonding is not the same thing as I have to be home with my child because the child care ended. So this is, again, really clear. Stay in your lane, understand what they are using the benefit for. They don't get 12 more weeks of Family First FMLA. It's FMLA. But FMLA and CFRA don't run concurrent with pregnancy disability leave. FMLA and PDL run with pregnancy disability leave, and then you get 12 weeks of baby bonding to utilize after the baby is born. So make sure that you are really clear why they are taking the Family First FMLA. Could there be an instance when they cross over? There might be, but you want to make sure you're clear how they're using it because that's when it would cross over. So as with all of our other recommendations, ADA, FMLA, FEHA, and what we've been training for almost 20 years, same process, same implementation procedure, same method of analysis, same documentation procedure, including if you're documenting it's an undue hardship because of the request for Family First FMLA, or it's an undue hardship to provide them additional leave for their own FMLA COVID issue after they exhausted FMLA. Make sure that documentation and all of your records are the same and use the same meeting format. If you are bouncing around in the way that you are speaking to people, you're texting, you're emailing, every text and email is followed up with a letter, everybody. Why do we do that? Because the employee is going to say, well, I talked to her 3 times because they called you 3 times. And you're going to say, I don't have a record of that. I only did that. I don't know. 3 years from now, you're trying to remember they talked to you 3 times. And if you've got little records of it that don't really explain what occurred, and it had to do with denying a benefit, you're going to want that in writing. You're going to want to confirm they got that. You're going to want a document that says you have a record, they received that notification and they still chose not to come back to work. This will really matter. Stay in your lane. Trust your skills. Your HR, you got this. This is what you're good at. You don't need an attorney to tell you how to create a standard operating procedure. You know how to do these. Decide what your culture, your industry, your environment can tolerate. Somebody might be incredibly more generous than a very explicit manufacturing environment. What are your HR industry standards?
It's 12 o'clock.
And document, document, document. Now, this is some information about who we are. These are some of the trainings we'll be doing. We're doing a 2-day live training next week, actually. And then I think we're trying to do a in-person training in Fresno. It looks like it's probably going to be live stream also. And then we're hoping the Marina del Rey, the San Diego, and the Oakland will all be in-person 2-day trainings. And what we do is we do what we did all day today, is we teach you to know what you don't know, to make sure that when it comes to your attention in a way that maybe you didn't expect, that you are creating real procedures to deal with it. So from that point forward, everybody is being treated the same way. And I just want to make sure, I do have one other question here that I'm going to answer before I go to the chats. Can we also ask how network is re-entering the workplace? Oh, God, I'm glad I did this one. Changes made, more telecommuting. Do we provide masks? What are we doing? This is what I'd like you to consider doing. Again, let's not recreate the wheel. If you've already got a RIF procedure, you've got a return to work procedure. And I don't mean, let's say not return to work, return to working, RTW. Let's say, I guess the same thing. Return from COVID. How about a WFC procedure? You got to decide. Now you can make it whatever you want, as long as you're not discriminatory. So if you want your return to COVID work procedure to be best performers, seniority, with no performance issues in the last 6 months, and they're getting back to work first, that's okay. That's okay. But you've got to do it the same way for every single department. So you don't end up inadvertently bringing all of the lesser paid employees back first, who all happen to be young, by the way, and the older employees that happen to be over 40 are coming back last. That would be problematic. So you can see that a RIF, and again, you guys, I'm looking at the people who are here. So my understanding is you know what I'm talking about. When you're doing a RIF, you're creating a matrix of every protected category in the EEOC in California, and you're determining how many people are in each category. Do the same thing for return from COVID and come up with a objective methodology for bringing them back. And then in terms of mask, follow the CDC. And there's CDC by industry. And some industries have a higher level of protection that they need to provide. You're in a health and safety environment. Get the IIPP involved. Get a code of safe practices for CDC. There's at least 5 different resources on the internet on what you need to be doing. And there's some more that just recently came out. So don't be afraid to use the resources you've been using all along. You know how to do this. Don't recreate the wheel. Use the methodologies you've been using successfully as a professional HR manager. Modify them in an objective way that you can consistently implement, that does not discriminate against a different class, age, race, or other protected employee, and you're treating everybody the same with respect and dignity. And if they are scared and concerned, you're meeting that need by talking to them. And if you simply can't help them and they need to come back to work, you're treating everybody the same that way also. So let's see, we started with some, I hear you, do you hear me? I think that's okay. I tried to do the pre-work, but it wouldn't open. I think it's due to security controls at their firm. That's probably true. But if anybody has a question, I'm not sure that anybody had any. So let's see. Are you going to send out the slides from today's presentation? That's really the only question I have. And yeah, we will. We'll send them out. Does anybody else have anything else they'd like to share or any questions they have? I will open the mic up if you want to raise your hand. Otherwise, thank you very much for joining us. I hope this was helpful and gave you a different perspective of how you can approach this challenge from your role as a professional HR manager who is creating standard operating procedures through the end of the year. And please, if you do create modified policies, make sure it is crystal clear that everybody signed for it and they understand the policy expires December 31st, 2020. And the Q&A, I guess, is a different place. Let me see. Oh, the Q&A, I guess, is a different place. So thank you, everybody. Have a great rest of the week. And we appreciate you taking the time to join us. And please let us know if there's anything we can do to help. I believe if you go to our webpage on LMS, we do have free consultations. This is actually the workshop information, but we do have a free consultation. You can schedule that at any time if you've got any additional questions, but take a look and look for the emails about when the next meeting will be. I think it'll be in a couple of weeks at the end of the month. If you do choose to become a member and you're interested in our forums, you can become just a COVID member and you get access to all the free resources, including the ones that will be on the webpage by the end of the day. Those free resources I showed you, I don't know where they disappeared to, but they were there.
It's there now.
They're there now. Okay,
Yeah, they're there now.
they're there now. You can get access to all of these documents, FMLA, ADA, CFRA, the transitions with baby bonding, all of that stuff by becoming a member, or you can just become a COVID member. And the way we wanted to show you the COVID resources, let's show you those. And are they there? There they are. We don't know what happened to them, but there's a lot of really good resources here, and they're
Can you share your screen, Beth?
Oh my goodness, I'm not sharing my screen. Okay. Go over there. How do I get to sharing my screen again? Oh, here we go. Thanks, everybody. So the COVID resources are right here. And these resources have a lot of the Department of Labor questions and answers, which are really good. And the ADA, the most recent ones from ADA. And basically they say what I've been saying all along is it's very important to have a procedure, but man, it's gotta be confidential. That is the most important thing. It needs to be a confidential procedure and consistently applied. So thanks everyone, bye.
I'm trying.
Excuse me?
Okay, there we go.
Okay, cool.
Yep.
All right, cool. So did I get all these questions answered? I did.
Yes.
Okay, cool. All right, guys. So I don't know how, do you feel that went? Let's stop the recording, please.
Okay, stopping recording.
We are not